In today's health headlines, more on Omicron, now present in 5 states. What are the differences between Omicron and Delta? How should we live life differently in an Omicron world? And how well do vaccines mix and match? Joining us is Dr. Jamie Meyer, Yale Medicine infectious diseases doctor and associate professor at Yale School of Medicine and Public Health. Welcome back, doctor.
Great to be here.
Always great to have you. So with the Omicron now present in more states, can you tell us the differences between Omicron and Delta, which we're still fighting here in Connecticut?
Sure. I mean, some of this remains to be seen in terms of how Omicron and Delta are different clinically. But just a reminder to everyone, these variants happen when the virus is spreading in the community, when the virus is replicating, it's copying itself, and it makes these mistakes or mutations as it copies itself. Now, if those mistakes or mutations have a survival advantage, and all the virus really cares about is surviving, then that's the predominant variant that sort of will grow out. So both Delta and Omicron are different variants of the same virus. There are some overlaps in which mutations they have, but it does appear that Omicron has about 50 different mutations, including some of the ones that it overlaps with Delta. We'll have to wait and see sort of what the differences are in terms of the clinical outcomes.
Okay, how should we change our behavior with Omicron now in the picture?
I mean, it's hard to say exactly because we know based on where these mutations are that there's the potential that the Omicron variant could be more transmissible. There's the potential that it could cause more severe disease or that it could sort of escape some of our known therapeutics or even our vaccines. There's the potential for those things. We don't know if any of those things are true. It'll be a couple more weeks. So in the meantime, as we're waiting for more data to come out, we have to use the tools that we know work to decrease spread, things like staying home if you're sick, identifying early disease, getting tested, masking up again, and certainly using the vaccines that we know work really well and are likely to work well here too. We can't say in terms of preventing severe disease.
All right, new research out of the UK looks at how well vaccines mix and match. What is the latest?
Yeah, when the CDC recommended the mix and match strategy for boosters, it was based on somewhat limited data. Now we have a large randomized controlled trial of about 3,000 individuals published in the Lancet, and it looked at people who either got the AstraZeneca or the Pfizer primary series, and then were randomized to get one of 7 different brands of boosters. Only 2 of those are actually available in the U.S. Basically, no matter what booster people got, it was safe, it was well tolerated, really few adverse effects, and all of them sort of equally boosted people's antibody response.
Good to hear. I mixed. They had it, so I got it. So I'm boosted. All right, Dr. Jamie Meyer, thank you once again for the very latest.